Please sit down. Nova Southeastern University, the 45th Annual Commencement Exercises. Greetings. The trustees of Nova Southeastern University, the President, the Board of Governors, the administration, and the faculty bid you welcome to this joyous celebration for the conferral of degrees upon those whom the university honors for learning and diligence, and upon those whom the university charges to turn scholarship into service. Will the audience please rise and join the faculty and graduates in singing the Star-Spangled Banner? You will find the words in the front of the program. Sit down, please. It is my distinct pleasure and honor to introduce to you Dr. Ralph Rogers, Provost and Executive Vice President for Academic Affairs. Dr. Rogers.
Thank you. We welcome all of you who have joined us today to honor the members of the class of 2015 to these commencement exercises. This is the 21st annual graduation of the Health Professions Division of Nova Southeastern University. At this time, I would like to recognize Trustee Sylvia Flores, today's Grand Marshal. Trustee Barbara Landry. Trustee Barry Silverman. And Trustee Zachariah. The Board of Governors joining us today are Dr. Howard Neer and Dr. Mel Crone. I welcome Dr. Irv Rosenbaum, Dean for the Administration of the Health Professions Division. I would also like to introduce Dr. George Hamberry, President and Chief Executive Officer, and Jacqueline Travisano, the Executive Vice President and Chief Operating Officer. I would now like to introduce Dr. Linda Neeson, Dean of the College of Dental Medicine. And Dr. Elaine Wallace, Dean of the College of Osteopathic Medicine. Thank you. Also assisting us today for the hearing impaired is Ms. Heather Lubrato and Ms. Kathleen Stevenson from the Nationwide Interpreters Resource Incorporated. A university becomes great not because of buildings or athletic accomplishments, but because it develops an outstanding student body through the guidance of its faculty. Also sitting on the stage behind me today and in front of the graduates are distinguished members of our faculty and administrators. Please rise and be recognized. Thank you. You now may be seated. I would now like to ask Dr. Fred Lippman, Chancellor of the Health Professions Division, to come forward and welcome you to this ceremony.
The Health Professions Division of Nova Southeastern University is constantly a growing and expanding institution, featuring the finest of health care education. We are proud of our growth and our accomplishments. Before I just move on to welcome all of you, I want to also wave a welcome in this inclusion to the moms and the children and the kids and babies and grandmas that are in the flight deck. So hi, guys. I welcome the members of the graduating class of 2015. The relatives, the friends, the significant others, you are an important part of this festive occasion. Having more than a passing acquaintance with your faculties and curriculum, I know that you were given as much training as possible. I hope you have been able to absorb the zeal, the personal interest of your faculties and of this university as an example, as a positive role you should seek to emulate. My hope is that the faculty administration and all the people you have come in contact with here at NSU Health Professions Division have given you the desire for honesty, integrity, and dedication. The traits which will give you, and as you develop in your careers, a good name. As you create your own good name, you will be helping to spread the name of this great institution, NSU, and the Health Professions Division. One cannot succeed without the other. We have been very honored to have you with us as students and part of our family. We are now honored to have you as alumni. Congratulations. May good health and success be your rewards, and especially may every single one of you achieve a good name. And now, to open the commencement exercises, I am honored and privileged to request President George L. Hanbury II to come forward. Mr. President.
And thank you, Dr. Lippman. To the members of the Board of Trustees, to our guest speaker, Dr. Mary Todd, and to all of you here who have come to publicly witness and celebrate the academic achievements of those graduates this afternoon, welcome to NSU. You know, this is the beginning of a tradition because this is the first commencement season of 45 commencement seasons that this university has had, that all of the commencements will be on the main campus. And it's also an opportunity for those individuals who may not have had a chance to be on campus to celebrate with you the beautiful campus that NSU has. But today is not just for tradition and establishment of tradition. This is about the 412 students that are sitting in the audience today, and to celebrate your graduation. Let's hear it again for the class of 2015. Because we want to keep the graduates to around 500 or less, so that all of the loved ones would be able to come into the arena without tickets, we will have 11 commencements similar to this. 7,500 degrees will be awarded during this 45th commencement season. And to give you some idea, you're never too old or you're never too young to achieve an academic degree. Our oldest graduate this year is 63 years old. And our youngest, an undergraduate, 19 years old. But no matter what your age, I'm sure all of you have made new friends. You've downed more than the FDA-approved limit on Red Bull. You've made memories, and those friendships will last you through your entire career and the rest of your life. But you all stand out unique to make up this incomparable class of 2015. As a group, you reach out globally. Not only does this graduating class include students throughout the state of Florida, but we're all over the nation, from Connecticut, New York, Georgia, Washington State, Oregon, California. And from countries such as Brazil, Israel, Venezuela, Saudi Arabia, the Bahamas, Jamaica. In fact, our graduating class this year is from 45 different countries, in addition to the states of the United States. One thing everyone had in common here when you first came, no matter what state, commonwealth, or country you called home, you had one thing in common, and that was you did not know what was in store for you in the years ahead, even though you had unlimited hope. Today, things are much different. You have a strong foundation, but one thing is very clear. You still don't know what lies ahead for you in the years ahead. You will find that this combination of anticipation and uncertainty will travel you throughout life. But it's a normal part of any significant growth in individual and a transition of your life. While this notion may have been scary and intimidating when you first came to NSU, I hope you understand, as graduates, that these are amazing possibilities and a wonderful part of the journey that's yet ahead for you. Now, I know it's expected of my generation to tell your generation, you just can't imagine the opportunities before you. But it's really true. If you just think back, and you don't have to go too far, from the 4 years you've been at NSU to possibly even the 4 years before that, do you realize what has been established and invented. 8 years ago, Apple was struggling. Now everybody carries an iPad, an iPhone, or an iWatch. There was no such things as a drone operator, a professional blogger. Search engine optimization was as if it was something out of Dick Tracy. Now they are careers. As physicians and dentists and students in bioinformatics, public health, all of those programs will have new technologies and new innovations that you never thought of. And certainly, there was no such things as tweeting. As a matter of fact, you're probably surprised I know how to pronounce tweet. And I'm sure some of you have heard of hashtag. Matter of fact, we've established hashtag NSU success. Or maybe yet hashtag in President Hanbury is awesome. Now, you won't find hashtag President Hanbury is awesome, but you will find hashtag NSU success. I encourage you to put that hashtag. Keep us informed of your successes and your opportunities as you go forward in life. We know you're better prepared today. The faculty, the staff that have worked with you, I feel has helped you to establish, through your experience in clinical trials, that you're prepared for the unknown. Because you see, it's not what you don't know today to face tomorrow. It's what you do know today to be able to face what you don't know tomorrow. So once you exit these doors this afternoon, you will open the next door behind you, and I encourage you to make a positive difference wherever that door may lead you. Some of you will join the military, and I had the wonderful opportunity yesterday to participate in the entire program for the promotion of officers in the United States military. And some of you, as a matter of fact, are indeed graduates. 16 of you were commissioned. I'd like for those 16 to stand and be recognized. As a matter of fact, some of you are even veterans, and we have veterans and active service people in the audience today who are families and loved ones and friends and associates. I'd like for all veterans and active military to please stand and be recognized. Many of you will go on to public service or private practice. All of you have been able to unleash your potential to lead. We even have a graduate today who's getting 2 doctorates. One on this side of the room and one on that side of the room. Aaron Goodwin will... Aaron will receive his doctorate of osteopathic medicine and doctorate of dental medicine this afternoon. Let's give Aaron a huge hand of applause for the hard work he's doing. And believe it or not, in his spare time, he participated in a lot of other activities at the university in the role of leadership. So whatever path you choose, I believe we have unleashed your potential to lead, as I said. To lead by example is to question the status quo. One of the underlying philosophies of NSU is that we owe the world questions. So get out there and ask what needs to be asked. Challenge what needs to be challenged, and leave a lasting legacy, a positive impact in your wake. All of you have outstanding examples to follow. As you think of the leaders that have inspired you and passed on their knowledge to you, I hope you will think of the faculty. Toward that effort, I'd like to share with Dr. Rogers and ask the faculty who are in front of you and behind me to please stand, and for you to give one last recognition to their service to you. As I said, the beauty of leadership is by example. It is a language that anyone could understand in any country and any language. It's a language that anyone can speak. The key to showing leadership is doing what you are capable of doing and doing it the best of your ability. That is leadership by example. In my mind, success is the progressive realization of a worthy goal. All of you started out 4 years ago with a worthy goal in mind. And day by day, month by month, year by year, you progressively realized the actualization of that worthy goal. So toward that effort, in my mind, each graduate today is a success. Now the determination to be in the future is how successful will you be? Will you establish worthy goals? And will you see that progressive realization of such a worthy goal? So I encourage you to conduct yourself throughout your life, always doing the best that you can do, and be the best that you can be, and lead by example, and continue to pursue worthy goals. But because it's only in worthy goals and the progression of realization of those worthy goals will you be considered a success. It seems almost axiomatic that you can't lead without knowing at least where you want to go. As that great philosopher Yogi Berra said, if you don't know where you're going, you might wind up someplace else. And you won't find that someplace else on Google Maps. You won't be able to tweet it. You'll have to discover that someplace else yourself. So as I said, today is that public recognition of your achievements. You're not someplace else. You're here. You're at NSU. And you're now beginning the rest of your life. So it's time for you to focus on what will be your next worthy goal. I also want us to remember those individuals that Dr. Lippman has recognized and maybe some of the people that are with us on the web, because we are streaming this worldwide through satellite. Some that may not have been able to see you today, but they're seeing you through the internet. I would like for the parents, the grandparents, the uncles and the aunts and the loved ones to stand and be recognized by you because they've supported you. As Dr. Wallace said, they may have even helped to finance you. Please stand, parents and grandparents, and be recognized, and students, recognize them. So it's your time now. You're at the end of your tour of duty at NSU. But I hope no matter what road you take, you don't forget your connection with NSU. You now become part of 165,000 graduates that have walked across some stage in the last 45 years to receive a degree from NSU. I hope you are as proud of NSU as NSU is proud of you. Your path will not always be easy, and you will face challenges, and you will face temptation. Those in the health professions especially will face temptation. So I challenge you with one last word, the admonition that Shakespeare gave to Polonius in his words of advice to his son Laertes. This above all, to thine own self be true. As it is the night the day, thou canst not be false to any man. So you don't have to have a big job or a big title or a lot of degree initials behind your name. But you do have to have integrity to be successful. Integrity. Integrity is like a mirror, graduates. Once it's broken, it's almost impossible to fix, to heal, or to put back together. So I end these comments to our graduates. Keep your aim above your reach and add 10% more. But always maintain your integrity. It is indeed your most precious asset. And quoting that one last philosopher, and some of the medical students who have been out on tours of duty and clinics may not be too familiar about this, but that great philosopher said at NSU, and I want to see everybody because you will not get a degree without it, fins up. Graduates, fins up. All right. Go Sharks. And now, it's my pleasure to introduce Dr. H. Mary Todd, who is to receive the honorary degree of Doctor of Human Letters. Assisting with the conferral of the honorary degree is Dr. Ralph Rogers, Dr. Sylvia Flores, and Dr. Fred Lipman. Would you please come forward, Dr. Todd, Dr. Rogers, Dr. Flores, and Dr. Lipman. Mary Todd, as a physician member of our armed forces and an educator. You have served your community, your state, and your country with distinction. For more than 40 years, you have dedicated your life to improving the health and well-being of the patients you have served. You've received your medical degree and completed your neurology residency at the University of Miami School of Medicine. You are a renowned psychiatrist and neurologist, board certified by the National Board of Medical Examiners, the American Board of Psychiatry and Neurology, and the American Society of Neuroimaging. You are also a fellow of the American Academy of Neurology, and in this capacity, you have received many honors, including being named Doctor of the Year and received the Mark of Excellence from North Broward Hospital District. You have shaped health policy on the state level as a member of the Florida Medical Association's Dementia Advisory Committee and Department of Elder Affairs, Alzheimer's Disease Initiative Community. You are a member of the American Medical Association, Broward County Medical Association, American Academy of Neurology, American Society of Neuroimaging, and Florida Society of Neurology. You served your country as a member of the United States Navy from 1967 to 70 as Lieutenant Commander and General Medical Officer. Additionally, you have helped educate the next generation of physicians, dentists, and other healthcare practitioners for more than 20 years. You have been a member of NSU's College of Osteopathic Medicine faculty since NOVA merged with Southeastern in 1994, currently serving as chairman of neurology. You also teach in NSU's residency program. H. Mary Todd, in acknowledgement of your service to your state, your country, the Board of Trustees of Nova Southeastern University is proud to confer upon you the Honorary Doctor of Humane Letters, Friday, May 15th, 2015. Dr. Todd.
I'm going to remove my cap. What an honor. I was surprised. I didn't realize this was going to start this way. I thought I was just going to be giving another lecture to the medical students. I'd really like to tell you that to be here is an honor, and I'm very humbled by this. But I don't wish to take anything away from this day from you all. This is a fantastic day for you. I want to start by thanking President George Hanbury, Dean Elaine Wallace, Dean Linda Nessen, and Chancellor Fred Lippman, who I've known for a few years. 40 or more probably. When Fred had called me and asked me if I would be honored enough to speak, I accepted, but I asked him, what is it you'd like me to say? And he said, well, you have to decide that. Just be Murray Todd. And that's not going to be too hard for me. But I thought, having spent some times in the past on the podium at other graduations here at NSU, I didn't really want to stretch this out too long. So, as my own changing of philosophy of the term KISS, I'm going to keep it short, stupid. And I'll see what I can do to keep it short. Let me start by going back a few years, many years, probably before most of you graduates were born. I graduated from medical school at the University of Miami School of Medicine in 1966. A similar thing was happening then in the care of patients and persons in our country that's going on now. A year before I graduated, in 1965, President Lyndon Johnson signed into law the Medicare law. Now, you all know about Medicare, and you don't even bat an eyelash. When I was a junior medical student in 1965 and a senior medical student waiting to graduate in 1966, Medicare sounded like a disaster. It was the worst thing that could have happened. The government was taking over. They were intruding on our care of patients. It was going to just collapse. But it didn't. I was saved from Medicare for the first few years, about 9 years before I came back out of my internship, which I spent in the Navy, to do my residency. And even then I was employed. So it wasn't until 1973, graduating in 1966, that I actually was part of the workforce and was paid as a practitioner of neurology. Things have changed. We are now in the present. The year before you all started your training, President Obama signed in the Affordable Care Act. This act, to the doctors, had the same feeling as the Medicare Act. This was going to be a disaster. It isn't a disaster. It's a change. We hate change. But we're going to deal with change the same way I dealt, and my graduates, and the graduates after me, and the ones before you, and the ones after will handle the problem. There's going to be some bumps. There's going to be some ups and downs. There's going to be some changes. There will be more changes, some of which we'll like, some of which we won't like. But we'll put up with them. And I am very confident that you, practitioners of the future, will have no problems whatsoever dealing with this. It is your legacy as it was mine, and the students and residents and doctors in between. We must carry this load. The politicians are just going to bang each other around anyways. We don't want to get in the middle of that. Our job is to take care of people, and we will continue to do that with whatever rules. Now that you all know your place in this legacy, let me just tell you what it's been like and what I have learned, and will try to instill in you some qualities of doctors. We're different. We're a different bunch. Sometimes people think we're a strange bunch. But we have different ideas about things. We have to change the way we think about things because we take care of people. We manage people's lives and everything they do about their health. We are trying to be involved in. So let me give you 10 qualities that I've tried to use and instill in my practice throughout my career. Some of the time I've been successful, and like you and me, some of the times I'm not going to be successful. I do believe, however, that these qualities separate the good doctor from the great doctor. You all don't realize, but I expect you all to be the great doctors. The first quality is humility. I put it first because I just told you that I wasn't very humble by telling you I thought that you were going to be the best, but I know you will. But we must understand we have to instill a feeling with our patients that we are equals and not above them. We are probably more educated than most of the people we'll care for. We may be wealthier than a lot of the people we care for. That has nothing to do with it. We must be equal to those folks so they understand. They will trust us more if they know that we're equal and not above them. Those of you that know me well, the next trait I sort of maybe fall down on, passion. Have you ever seen me have any passion? Have you ever seen me not have any passion? I have to control myself because I am so excited and passionate about being a physician and seeing young student candidates become doctors. I just can't stand myself. Can you imagine what it must be to be a physician, to take care of someone who's dying but doesn't die because of your intervention? Is there any profession that can say that? And when the patient says, "Thank you for saving my life," do you have any idea how that feels? And you're going to get paid to do this? I mean, it's crazy. And it's going to be that way when you get into practice. Not everybody you take care of will be saved or die, or you will be the lifesaver of the world. But just taking care of people pays you back. And besides, you get to be paid. Remember that passion is a compelling enthusiasm of excitement. Demonstrate your passions to your patients so that they see the same in you. Don't be a bore. Don't sit there like a lump. You're not lumps. You have emotions. You have passion. Show them. Judgment. Keen understanding of how to solve problems. You must have judgment. And you must have good judgment. Making proper decisions. Knowing when to act, how to act, what to say, and when to shut up. Sometimes the latter one there isn't always done so well for us. We need to know when enough has been said. Respect. Respect for others. Treat others as you would treat yourself, or better yet, your family. See all your patients as family members. Treat them as such. There can be no differentiation for whatever the person is, whatever their age is, their race, their sexual orientation, whether they're rich or poor. They are all humans. And if you haven't realized yet, we take care of humans. Educator. Never, ever stop teaching. If you can't teach anybody anything, teach yourselves. But better yet, be a teacher of other doctors, dentists, therapists, nurses, lay people, patients. Don't stop teaching. Be the health educator of your patients for the entire existence you practice. Communications. We as doctors do a good job communicating? Yeah, well, I'm going to watch out for you, so you better be careful. Because I consider myself a pretty damn good communicator with patients. And you better be able to match me or beat me. The ability to convey your thoughts, ideas, actions, plans to your patients. Explain their signs and symptoms to them. You're the one that knows. They don't know. They're frightened. They need to know. Discuss their disorders, their prognosis, the outcomes, the treatments. Face-to-face, over the phone, letters, internet, smoke signals. Communicate. Don't stop. Don't let me hear again a major complaint of patients. My doctor didn't discuss my illness with me. Don't be that doctor. Honesty. I don't have to say much about honesty. Obviously, you're not a bunch of liars, so I'm not worried about that. What I really want to tell you is be honest and be forthright. Don't hedge. Remember, the persons that you're seeing, the patients that you're taking care of, are asking for your professional advice. So be honest with them and give that to them. Punctual. None of your doctors ever make you wait. They don't, please. Don't tell me they don't. None of you, if some of you are my doctors, if some of you are my patients, you know that one thing I pride myself on is being on time. I think doctors really need to get their heads together and be on time. I think to make someone wait 2 hours is awful. So what an opportunity for me to have you all here to tell you that. Now I'm going to watch out and see. And if I know you didn't listen, I'll be coming after you with a stick or a board. The last quality is the one that means the most to me. It meant a lot to a very famous doctor, Dr. Francis Peabody. Probably never heard of him. You can Google him. The first thing it'll be is Francis Peabody's quotes. This is the quote. The secret of the care of the patient is the caring of the patient. Now that sounds like something Yogi Berra would say. But if you think about it, that's a profound statement. That's exactly what we're talking about. Let me tell you a little story about something of caring. Some years ago, maybe 15 or 20 years ago, it was Christmas Eve, and I was with my family. Two of my children had come from out of town. We didn't have any grandchildren yet, but it was going to be a nice Christmas. Unfortunately, I was on call, emergency call. So I decided I better go to bed early because in those days we got called a lot in neurology. At 3 a.m. in the morning, sure enough, service called me. And the emergency room doctor said, "I'm sorry, Marie, but we've got a tragic case here. I have a 68-year-old subarachnoid hemorrhage. On her way to the hospital, they had to intubate her. I don't know how well she's doing, but she's in a coma. Can you come and see her?" I said to him, "It's Christmas morning. Does it really make a difference?" After I said that, he said, "No, it doesn't. She's probably going to die." And we had a quick, short conversation, and he hung up. I came back into the room. My wife, of course, every time the phone would ring at night, she'd be awake. And she said, "Murray, what was that?" And I said, "Oh, it was just the ER. Some woman died." And, well, she's not exactly dead. I said, "Murray, it's Christmas morning. Aren't you going to go in?" You talk about humbled. It got even worse. I went in because I was guilty about saying I wouldn't come in. It didn't make any difference. Christmas morning, I needed to go anyways. When I got into the emergency room, the woman, who I didn't have a name before, was my best friend's wife. Their whole family was there Christmas morning. And I had the process of being able to tell them that their mother was going to die. Actually, she was already brain dead. Rather than tell them that up front to begin with, I was a bit dishonest, and I hesitated a while, and I said, "We'll look again in 12 hours. I'll keep an eye on her through the rest of the morning and into the day, and I'll let you know." Then I spent the next hour and a half caring. You understand? I wasn't caring for the person that was sick. I was caring. Caring for the mom, the dad, the brothers and sisters, the 7 grandchildren. So caring is a very important thing. Let me give you one other little tip, something that you can do very, very easily, very free. At the end of your clinic day, look through your categories of the people that you've seen. Look over. You know what you said and what you talked, and you know what it's about. See if there isn't maybe one or two that just didn't seem to get it, or maybe were more frightened than you really realized, or maybe needed more encouragement. Call them unsolicitedly. You didn't tell them you were going to call them. Just dial them up. You're going to be absolutely taken back. They will be so happy to you. They will praise you so much. You'll get so much more that particular day, plus you get to do something better for them. You made them feel better. The man comes to my office. He's got trigeminal neuralgia, a horrible facial pain. He couldn't even talk because of the pain. I started him on a medicinal that was usually going to stop the drug, but I wasn't sure. So he was on my list, and I called him. His wife answered the phone. I said, "Mrs. Jones, is your husband there?" And she says, "Yes, he's enjoying dinner, but I'll go get him. He wants to talk with you." I said, "Oh, he can talk now?" He says, "Oh, yeah." He came to the phone. He was flabbergasted. "I can't believe you called. Why did you call?" And I said, "I just wanted to make sure you were okay." Do that every day, once or twice to your patients. It'll make you a much better doctor, and it will make those people anyways much, much happier. And that's caring. In closing today, let me remind all of you that in a few minutes, each of you will not only gain the right to change your name from Mr., Mrs., and Ms. to Doctor, but you have the honor, after 4 years of a troublesome, expensive initiation, you will join the greatest healthcare doctors fraternity. It's a great honor that I have over everyone up here. I get to be the first one to welcome you as doctors of medicine and dentistry and welcome you into my fraternity. Congratulations. Thank you very much.